Researchers often use and talk about routine data. This video is about what this means. All of us use public services at some point in our lives. This could be schools, doctors, hospitals, or social care. When we use these services, information about us is recorded. This is stored on a computer and held by a central public sector organisation. It's called routine data as it is collected routinely when people use public services. Doctors need to see patients' notes in order to be aware of their medical history and to enable them to make informed choices and give accurate advice and medical care. When someone goes to hospital, their medical records are held by the hospital and then are held centrally, for example by a relevant government department to monitor and improve care at a regional or national level. School examination scores are recorded for all pupils by schools and then held centrally so that they can look at the results at a national level. Local authorities collect data on children that interact with social services. Some of this is reported and held nationally too. All this data provides important information about these services, including whether they are effective and how much they cost. Routine data not only helps these services to compare numbers at a national level, but can also be used for research. Departments who then make routine data available for research are called data providers. Research can be commercial, meant for profit, or non-commercial, meaning not for profit. Here we are talking about non-commercial research. Patients' routine data has often helped to diagnose an illness earlier, or what causes an illness in the first place. For example, multiple courses of antibiotics can make you more prone to a stomach infection later down the line. This was discovered through research using routine data. Routine data can also be more accurate, as it avoids relying on a patient's memory. It can also be a better way of getting sensitive information, instead of asking personal questions that may cause embarrassment. Researchers need to apply for access to the routine data. They have to explain why they need the data to the data providers, how it will benefit the public, and show they will hold the data securely and only use it for the purpose stated. Strict rules must be followed to ensure only approved researchers use the data. There are two ways that routine data may be used. Researchers can request an extract of data that they do not link other information to. Instead, it is a dataset that does not identify anyone and does not have any information that would allow you to work out who is who. It's useful to use these anonymized datasets to look at trends over time using data on lots of people. This is just one example of how such data are used. Sometimes the researcher is interested in events that don't happen very often, and so need a large number of people in the data to understand what is happening. Because no one can be identified, it is then not possible for researchers to ask for their consent. Researchers can use routine data and link it to other information a participant in a study has provided, for example via a questionnaire. There are a few steps that researchers follow to get the routine data linked to their participants. The research team have a list of people in their study who they plan to link data to. This list will contain identifiable information such as name, postcode, NHS number or pupil number. An automated study ID number is also allocated to each person. This means your questionnaire data is only stored with this number, never your name or other identifiable information. The identifiable information and ID number is sent securely to the data provider once the research application has been approved. The data provider will find those people in their own databases and extract the data requested. Before the data provider sends the data to the researchers, the identifiable information is removed and only the automated ID number is kept with the data. This is to ensure that individuals cannot be identified. When the researchers receive the data, such as schools' records for example, they will check it and then link it to the participants' questionnaire answers using the automated study ID. All of this is done electronically and held securely with only the authorized staff accessing the file. The dataset that is created looks like a list of numbers and codes, and on looking at it you wouldn't know who is who and what the codes mean. Participants will know about the project that they are taking part in. They will have either consented to this linkage or given the option to opt out. Either way, they will have been directly contacted and provided with the information to decide whether they are happy for the research team to do this work. The building blocks 2 to 6 study is research carried out by Cardiff University and funded by the Department of Health. It is following up a group of mothers and children who took part in a research study. We are now seeing how they are getting on 4 years after taking part in a research study using routine data linkage. The study looked at how additional visits from a specially trained nurse could help mothers and their first child in the first 2 years of life. All of the mothers were given the option to opt out from this follow-on study. We have been able to link together information from the Department for Education in England to see how the child gets on at school, as well as if they have had any support from social services, and Department of Health to see who has been to hospital and what the cause was, and to see if the mother had any further pregnancies. This has allowed us to understand how the intervention has helped these families after the end of the trial. Using routine data and data linkage is an important method for researchers. It is also important that the public and study participants understand how and why their routine data is being used.